Good afternoon. We'll now start the pep talk. As a reminder, please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your face in the video. Another reminder, please take the online learning home evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. The link has been placed in the chat box. Another reminder, obtaining 50 or less certificates will entitle one mentee or participant to a voucher for a ROJoson telemedical consultation. Feedback to this pep talk, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video and show your face. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Breast Self-Examination, a must-do for all Filipina. The empowerment objective is for all Filipina to have an essential understanding of breast self-examination as a must-do in all Filipina in their health management. The contents of this pep talk will be the following. What is a breast self-exam? Why is breast self-exam a must-do for all Filipina? Why is screening mammography is not a must-do for all Filipina? How to do BSE? How to interpret the findings in BSE? And what is ROJoson's advocacy program on BSE? I'd like to mention that this pep talk contains ROJoson's thoughts, perceptions, opinions, and recommendations, or TPORs, culled from experiences of other professionals as well as from ROJoson. What is a breast self-examination, or BSE? BSE is an examination of one's own breast, usually through inspection, meaning looking at one's own breast, and palpation, meaning touching and feeling with fingers one's own breast for anything unusual, any abnormality, or any disease. So that is the definition of breast self-exam. Why is BSE a must for all Filipina? Breast self-examination is a must for all Filipina who love themselves and their bodies and who are concerned with their breast well-being. Notice I didn't use the word wellness, because wellness is focused on physical health, but well-being encompasses wellness and includes physical, emotional, and psychological health. I preferred the term breast well-being over wellness. BSE is a must because the most dreaded disease of the breast, or breast cancer, can strike anytime or at any age to all Filipina, young and old, as long as they are still alive and until they die of other diseases. BSE is a must because breast cancer is the most common cancer in the Philippines among the Filipino women or the Filipina. BSE is a must as no Filipina should rely solely or only on a physician or a breast specialist in their goal to achieve breast wellness. Also, BSE is a must as no Filipina should rely solely or only on laboratory tests such as mammography and ultrasound, even if they are done yearly or every 2 years, in their goal to achieve breast well-being. Lastly, BSE is a must because it is simple to do, it costs nothing, and it is the primary and foremost early breast cancer detection tool. The physician's clinical examination of the breast and breast laboratory tests such as mammography and ultrasound are secondary and should be preceded by a BSE. At present, majority of breast cancers among Filipina are discovered through BSE and not with physician's clinical examination of the breast and breast laboratory test. Thus, BSE or breast self-examination is a must-do for all Filipina. All Filipinas should do BSE starting at the age when they can be taught how to do BSE and how to interpret findings on BSE. This age can start at the adolescence or teenage period. Adolescence is the phase of life between childhood and adulthood, usually from ages 10 to 18. This is the period in which it is considered an important time for laying the foundations of good health. BSE should be done until the end or near end of life, as breast cancer can occur up to the oldest age. All Filipinas should not just rely on physician's clinical examination of the breast and breast laboratory tests such as mammography and ultrasound, as this practice cannot be sustained because of the inconvenience and cost involved, which will just result to an irregular and haphazard program for promoting breast well-being. Why is screening mammography or mammogram not a must-do for all Filipina? Lately, it has been reported in JAMA that current evidence does not substantiate the claim that common cancer screening tests save lives by extending lifetime. And this the screening test here studied includes mammography. Screening mammography can still be done in Filipina, but in those with high risk for breast cancer, such as those with strong family history of breast cancer. It should be selective only, and not all should be done, and not routine. And mammography does not or should not replace breast self-exam. The other reasons why screening mammogram is not a must-do for all Filipina because mammography is associated with a lot of uncommitted readings by the radiologists. They usually put BI-RAD 0, needs further exam, and it's also associated with a lot of false positive readings and at times false negative readings. So a lot of times, the above have led to the undue anxiety for the patients, unnecessary added for additional procedures and more expense. Thus, for the above reasons, screening mammogram is not a must-do for all Filipina. How to do BSE? To be effective in achieving its goal of promoting breast well-being and detecting breast cancer early enough if it develops, BSE must be done correctly and regularly, at least once a month. The essential objective of BSE is to look for anything unusual. If anything unusual is found, an attempt at interpretation can be done. A breast specialist is consulted early as warranted. Note, it only takes a few minutes to do a breast self-examination. When to do BSE? For menstruating women, BSE is recommended to be done 7 to 10 days after the last day of mens. This is to avoid hormonal swelling of the breast tissues during mens being mistaken for a dominant mass, and to avoid the discomfort induced by palpating a breast that is usually sensitive during the time of menstruation. For non-menstruating women, the first or last day of the month is chosen. It can be done during bath time or any other time for that matter. Where to do the BSE? BSE can be done in any private place, such as in the bathroom during bath time. Standing up or lying down, it can be done either standing up or lying down. Note, it takes only a few minutes to do the breast self-exam. How to do BSE, the procedures. First, visual inspection, meaning looking. So expose the upper part of the body. In a standing position, face a mirror to view the entire chest and breast, like this. With both arms down and then raised over the head, look for anything unusual on the breast. Look for changes in the contour of the breast and armpits, such as bulge, skin dimpling, and flattening. Here shows some abnormality in the contour of the breast. Look for unusual changes on the skin of the breast, such as redness and lesions, as seen here. Now, in doing the palpation or manual palpation or feeling, in a standing position with one arm raised over the head using the flats of 2 to 3 fingers, such as second to the fourth fingers of the other hand, gently but firmly palpate the entire breast on the side where the arm is raised. I like to emphasize the use of the flats of the fingers and not the tips of the fingers. Feel for anything unusual in the breast and feel for possible presence of a dominant mass. This picture outlines the dominant mass being present. A dominant mass is an unusual density distinct from the surrounding breast tissues with a felt margin or border which connotes a three-dimensional lump. So in this illustration, if one feels a dominant mass, which is described as one that stood out and different from the surrounding tissues, then once a dominant mass is felt, it is considered a red flag, which needs further investigation. In contrast, when you feel a lumpy breast surface, it's usually normal, and this is what we call fibrocystic changes or hormonal changes. Cover the entire area of the breast by palpation, by going from one quadrant to another, or one quadrant at a time until all the four quadrants of the breast are palpated. So starting from this quadrant, then going down here, here, then going up to until all the quadrants are covered using the flats of the fingers. Before palpating the armpit, gently squeeze the nipple for possible presence of discharge. If there is nipple discharge, note the color. When palpating the armpit, put the arm down to have a lax or slack skin fall. Before place the palpating fingers initially at the upper portion of the armpit, then gently but firmly press against the chest wall in the armpit and slowly glide the fingers down to feel for anything unusual and to feel for the possible presence of a dominant mass, usually a lymph node. After one breast is palpated, do the same procedures for the other breast, which includes the entire breast as well as the nipple and the armpit. How to interpret the findings in the DSE? Take note of the difference between the lumpy breast surface and dominant mass. As I said, the real mass is the dominant mass, and if a dominant mass is present, it is considered to be a red flag. How to interpret? No dominant mass found on physical examination or on palpation in a person complaining of breast mass and in a person coming for a breast check. So if there is no dominant mass, even though there is a seeming presence of a mass, as long as there's no dominant mass, the diagnosis is normal or fibrocystic changes. Now, in case there is no dominant mass and then there is breast pain, or there is breast pain but with no dominant mass, the diagnosis is fibrocystic changes. Presence of non-sanguineous, meaning not red, nipple discharge with no dominant mass, fibrocystic changes is the diagnosis. In the presence of sanguineous or red nipple discharge with no dominant mass, the diagnosis is an intraductal papilloma. It's a benign breast condition. Focal erythema or redness and tenderness with no dominant mass, the diagnosis is mastitis or inflammation of the breast. Focal erythema or redness with a tender fluctuant, dominant breast mass, as shown here. The diagnosis is breast abscess. Cystic mass with no signs of malignancy, the diagnosis is a macrocyst. Cystic means containing fluid, and a cystic mass is one that is depressible or compressible on pressing the mass. One suspects cancer when there is a dominant mass with giveaway signs of malignancy in terms of signs of local invasion of the breast mass on the adjacent tissues and signs of spread. Or one suspects a cancer if there is sanguineous nipple discharge with an accompanying dominant mass, like this. So suspect cancer if there are signs of local invasions of the breast on the adjacent tissues, which can be represented by the following: fixation to the adjacent tissues, such as the overlying skin, inclusive of the nipple and areola, and underlying tissues, such as the chest, muscles, and ribs. Another sign of local invasion: skin changes over the mass that are suggestive or indicative of local invasion, such as ulcerations and fungation. Cancer is also suspected in the presence of signs of spread, the presence of palpable axillary or armpit lymph node like here on the same side as when there's a palpable mass here, it's a sign of spread. Also, the presence of a supraclavicular lymph node or a lymph node above the collarbone is also a sign of spread. So in these two cases, the presence of palpable axillary lymph node and supraclavicular lymph node, we have to suspect cancer because this connotes spread. So these constitute signs of spread. What is ROJoson's advocacy program on BSE? ROJoson's advocacy program on BSE dated as far back as 1982, a year after he graduated from his general surgery residency program from the Philippine General Hospital and started managing patients with breast concerns. He believes that BSE is the most practical way and very useful and economical at that to detect breast cancers among Filipina, as breast cancers is very common among the Filipino women. With his more than 40 years of experience in the management of Filipina with breast concerns, he does not subscribe to using routine or regular mammogram nor ultrasound of the breast as a screening tool for breast cancers. And the reasons are the following. He has seen a lot of inconclusive reports on mammograms, a lot of false positive reports on ultrasound of the breast, and false negative reports. An additional reason is that most patients cannot sustain a practice of regular mammogram and ultrasound because of inconvenience and cost. The ROJoson stance on routine screening with mammogram has been validated lately, one, by the Ukraine adoption of early diagnosis program over screening mammography with the blessing of WHO. So there's a WHO publication which is entitled Better Than Screening. So this is the early diagnosis program, okay, with WHO's help. Ukraine chose a cost-efficient policy to prevent breast cancer using the early diagnosis program, okay, and not the screening mammogram. Also lately, there's an article that has been published in the Journal of American Medical Association, estimated lifetime gain with cancer screening test. So the results show that current evidence does not substantiate the claim that common cancer screenings save lives by extending the lifetime. So it does not. So the test studied here includes mammography. In 2022, last year, ROJoson created a program called the BSE Awards, in which he would give cash awards as incentives to Filipina who would do regular BSE for at least 9 months. The primary objective of the award is to promote early detection of breast cancers among Filipino women. The awards were given to 65 BSE promoters and practitioners, and a total of 38,700 pesos were given in December 2022. The awards still ongoing as of today, 2023. A sample of a certificate that was given to a person, a Filipina who completed the course requirements on breast self-examination, a health habit to cultivate. Okay. Now, the plan for 2024, but this will be initiated before the end of 2023. So there'll be enticement and invitation of Filipina to learn how to do BSE and how to interpret findings and then take the online learning cum evaluation test exercise. OLETE passers will get certificates of commitment and accomplishment, certificates of proficiency, and certificates of mastery. So this is the sample of the certificate of commitment and accomplishment given during the first take. Certificate of proficiency, this will be given on the second year. And then certificate of mastery, this will be given on the third year of a person who will practice breast self-examination and who will pass the OLETE. So summary and takeaway, I have discussed all these things. What is a breast self-exam? Why is BSE a must-do for all Filipina? Why is screening mammogram not a must-do for all Filipina? How to do breast self-exam, how to interpret the findings in breast self-examination, and what is ROJoson's advocacy program on BSE. So, the overall stand or statement conclusion is that BSE is a must-do for all Filipina. BSE as a health habit is simple and without cost. It can be repeated anytime without added cost. It can be done anytime and anywhere. It can detect breast cancer and other breast diseases. It can detect early breast cancer as long as it is done regularly and properly, and as long as it is reported to a breast specialist early enough. Consult a breast specialist right away once a dominant mass is detected during the breast self-examination. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on breast self-exam. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions or make better decisions on breast self-examination as a must-do for all Filipina in your health management. This ends my pep talk. Breast self-examination, a must-do for all Filipina. I hope I have empowered you to have an essential understanding of breast self-examination, which is a must-do for all of you in your health management. Before we go to the question and answer portion or sessions, reminder, after the pep talk, please take the online Learning Kung evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. And then feedback to this pep talk, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the QA and interactions. Please turn on your video, show your face.